Today's presentation, as you see here, is entitled A Medical Guide's View of the Healthcare Galaxy, Putting Your Healthcare in Order. And our presenter is Dr. Glenn Wollman. And a lot of you, I'm sure, know Dr. Wollman. He's practiced emergency medicine for more than 30 years and was at St. Francis for how many of those 30 years?
A few
of those 30 years. Throughout his career, he has combined Western and ancient healing methods of treatment. He founded and was the medical director of a hospital-based integrated medicine program. And as part of his training, he has spent time with physicians and traditional healers in mainland China, the Bhutan, and collaborates, and I'm going to have a challenge here, Ayurvedic doctors from India, and maybe he'll touch on that in his presentation. He has studied internal and external martial arts for over 35 years and is professor at Santa Barbara City College in Oriental Medicine. He also has offered courses at the Santa Barbara City College Adult Education. He's written, performed, and produced the medical CD, Sleep Suite, and Dr. Wollman offers a life balance program to individual and groups through his private consultation workshops and seminars. So please join me in welcoming Dr. Glenn Wollman.
Thank you, Craig, and welcome everybody. I'm honored to be here, and I honor all of you for coming and taking time out of a beautiful day to be here. I would like to honor Craig, especially for putting on this wonderful forum. When I was preparing myself for this, I was looking at many of the past speakers and titles, and it's really a great service that you and Cottage do for the community. So I guess the first thing I need to talk about is the title and explain things, and already people are coming up asking me what FACEP is, so I'll get that out of the way. I didn't think that would be part of the talk, but it stands for Fellow of the American College of Emergency Physicians, and I worked for many years in emergency medicine, which I'll speak about in just a few minutes. So the first part of this, let me see if I can define the title for you. A medical guide. What is a medical guide? So in order to tell that, I will have to give you the story of my path. And I was thinking about it the other day. If I was studying the paths of people, it would be considered pathology. So I'm going to give you a little glimpse of my pathology. And because it's psychiatric grand rounds, I have two dreams that I'll throw into this, and hopefully some of the psychiatrists or sociologists or psychologists might be able to help me and guide me toward my light. So anyway, I started out very early, and I had my first dream, which was I was going to be a doctor, and I saw myself already as a doctor. So at an early age, the rest of my life was complete. I had no worries anymore. I didn't have to answer the questions, what are you going to be when you grow up? Where are you going to school? What's your major? What's all of these things. I already had it organized. Now I just had to manifest the plan that I've already done. So as I was growing up, I was able to start looking and reading about other philosophies and religions around the world, and also about other healing systems, because when my parents would treat me appropriately for some kind of an illness, they would go to a drugstore and get some over-the-counter medication and give me the medication, which would take care easily and very quickly of the symptom that I had, such as a runny nose, dried up my nose. But on the other hand, it gave me all sorts of side effects that I didn't want. You're all aware of this. I got sleepy, my mouth was dry, I couldn't see too well, many things. So I started wondering if there were other methods of healing people. So as I went through medical school and really loved medical school and appreciated the knowledge that has been gained through a scientific approach, I was also nurturing my own individual process of learning about other healing systems on the planet. And I kind of looked at the ones that were able to sustain other civilizations for centuries. So that's the first part of the process. Basically, I went into emergency medicine and spent 30 years seeing humanity at its best and its worst all over the country, learning many things and developing a process of how people should be healed, and I started using an integrative approach. I used Western medicine and science first because I think it is the best of all of them, but I clearly believe that the others have a very important place and should be included in everyone's health care. And speaking of health care, let's move to the next part of this. Let's see if I can figure this out. The healthcare galaxy. What is the healthcare galaxy? For me, there's 4 parts to this galaxy. I'm going to explain 3 of them briefly and spend the most time on the 4th one. First is government and legislation. This is where all the laws and rules come out, and this includes the laws that dictate what insurance companies will do and what HMOs will do, etc. This is a very important one, and the only thing I will say about this is it's important for us to become very involved in this. In fact, there's a proposition coming out in this election called Prop 86. This is a very important piece of legislature which takes tax money from cigarettes and gives some of it to emergency departments in California. And this is very important because the people that work in emergency departments do an excellent job, and Cottage Hospital and the Cottage Health System do a great job all around the county taking care of people, and it's important that we honor that. So I would say to all of you, as you get involved, look specifically at Proposition 86, learn about it, and then make your own informed decision. There are many things about legislation that's good and many things that are bad. It's part of our job to work on it and make more decisions to make it better. The second part is science, research, and development. Now this is very interesting. We've come a long way since Asclepius and Hippocrates. We have MRI scanners now that can see things before we have to do surgery. We have laparoscopic surgery, which has allowed people to come out of the hospitals and pro football players to be able to get back on the field within weeks rather than months after a surgery. They may not be playing as well, but that's not up to the surgeons. I also look at the medications that have been designed, chemotherapies, antibiotics, sleeping medications, pain medications. A number of great procedures have been devised and gone through in research. I also remember when I was growing up, I was watching a James Bond movie, a 007 movie, where he was strapped to a table, spread eagle, and Goldfinger had just turned on this laser beam that was going to be splitting him in half. And I now shift into what's happening today, and people are running by the droves to their ophthalmologist to have laser beams shot into their eyeballs so that they can improve certain deficits. So clearly, we've come a long way. There are issues, and these issues have to be addressed, costs and legislation, but as we get involved, things have the ability to get better. The third area are the healthcare professionals. Now for me, this is the area, it's my own bias, but this is the area that needs the least work. I believe that people that go into healthcare, and what I mean by healthcare now are the people that actually lay on hands. So that would be the doctors, the nurses, the techs, all the healers in all of the different modalities of medicine, people that are actually taking care of their patients. And I believe that the people that go into this area are dedicated to healing. Now there are, again, issues, certain, not enough nurses, not enough of this, paperwork, administrative things, but for the most part, I believe this is a great one. And in fact, I want to take one moment just to give my total gratitude to all nurses who go into this profession and do the things that they do. Without them, life would be very different for all of us. So the fourth area are the healthcare consumers. That be us. And this is where I want to spend most of my time, looking at healthcare consumers, because we are the ones that, no matter whether we're in the profession or we're not in the profession, we still, at some point in our lives, have to go into the system and be treated for something. So let's move to the next part of my title, which is putting your health in order. I look at 3 orders of health. And the first order is the order of illness and injury. During life, we're clearly born, we live, and then we die. There are various philosophies and religions that give us information about what happens after we die. Some say it's over, we're just dust. Some say that depending on if we lived a good life and did righteous things, we're going to go to a great place. If we didn't, we're going to go to a bad place. Another philosophy tells us that if we go through life and learn our lessons and release the consequences of our karma, then we will stop being on the cycle of birth and rebirth, and we will go to another great place. If we don't learn our lessons and we don't get rid of the consequences of our karma, then we come back again and we learn more lessons. And it appears that the lessons get more and more painful until we get them. So it seems like if you break that down, living a good life, learning good lessons, doing good things is very important, and that's what we're going to stress a lot today. So as we're living our life, and I've seen this in the emergency department, people are always coming in with illnesses and injuries. And it doesn't make sense sometimes. The father that is taking his 9-year-old daughter to her karate class and his 9-year-old son to his dance class, and going home to pick up his wife so they could be honored at a local community club for doing great charity work, gets hit by a drunk driver and is a quadriplegic. Doesn't make sense on some levels. So it's a question of how we prepare ourselves for these unexpected injuries and illnesses. And again, this is our first order, the order of illness and injury. Who's in this order and what's it about? In this order, people only go to the doctor when they're ill or they're injured. And even then, they usually will try all the home remedies from the family, or they'll listen to the expert advice of the people in the gym or the office workers that are experienced in all of the facets of medicine. And when those don't work, they will eventually go. Now, most of these people are not taking care of themselves. In fact, they're doing harm to themselves, eating the wrong foods, not exercising, not getting the right amount of sleep, et cetera, et cetera. And they don't care because they're victims and it's someone else's responsibility. Now, there is a small subset of people in this group that still don't take care of themselves, but they're happy with it. And they don't see themselves as victims, and they're okay. They just go along and enjoy eating the foods that they eat and not exercising, just having a good time, and they just deal with life. They still go to the doctor when they get hurt or ill. And there is a small growing set of people that actually do try to take care of themselves and don't go to the physician until they really need to. And these are people that are starting to take their own responsibility for what's going on. Now, as a medical guide, a lot of this area in this order is pretty simple. When you show up in the emergency department with right lower quadrant tenderness, with vomiting and nausea, with an elevated white count, and a positive ultrasound, you're going to have your appendix taken out, and you either have your own surgeon or you're going to have the surgeon on call. Not difficult and not necessary to have a medical guide. But what happens when you go to the doctor and they diagnose you with prostate cancer or breast cancer? Now you have some difficult decisions to make. Do you have surgery? If so, what type of surgery? Do you have chemotherapy? What type? radiation therapy, or do you have a combination of all three? And then we add to the mix the new, or actually old, integrative programs around the country and around the world, like Ayurvedic medicine, acupuncture, traditional Asian medicine, and multiple others. And if you haven't prepared yourself in the right way, you add anxiety and fear to the mix while you're trying to make these important decisions. So this is where a medical guide can come in. Also, when you do make a decision to decide that you're going to have surgery, there are things that can be done that can put you into a better place to have a more successful surgery, starting with certain diets that you can eat, certain meditations, certain stress reduction techniques that can be used. All in all, this is a very high cost order to be in. People get affected and they're not prepared for it. Fortunately, the medical community and Western medicine is excellent at acute care and illness. They do a great job in diagnostics and treatment. When we move to chronic care, Western medicine is also extremely good, but many of the other modalities have the ability to help us to potentially get off some medications, maybe to take less medication and therefore less side effects and other ways of healing. So when I work with people in this area, I am happy to work with them, but I also try to ease them into the next order of medicine, which I call the order of preventive medicine. Now, it's actually a misnomer for me because we're not really trying to prevent medicine. We're trying to prevent illness and injury. So what is this about? Now, the people in this order start to take some responsibility and they start to do things for themselves to get more knowledge about what's going on. They look on the internet when they have the first sign or symptom of something, and in fact they Google things and they have a better differential diagnosis than a third-year medical student would come up with. Other people wait for a diagnosis by a physician, and when they go to the doctor, they will then go on the internet and do research to find out about their illness or injury, and at that time they will learn as much as they can so that they can become a part of the treatment and decisions in their own care. So this is very important. Now, in this order of preventive medicine, there happen to be actual things that we do in prevention. We do childhood immunizations, we get periodic tetanus shots, and if we go to a certain country that has malaria, for example, prevalent, and the CDC recommends it, we'll take an anti-malarial medication, possibly, to use as a preventive medicine. So we do actually have some preventive medicines. In this category also, people are focused on prevention, where they jog to prevent a heart attack. They eat certain foods to prevent diabetes type 2. They will do other things, not smoke, so that they prevent lung cancer. And all of these things are good. So we look at this area, and for me, this takes on the process of balance. In this order, we need to come into a sense of balance. And I look at balance and I break it down into 6 categories, which we'll briefly go over. The categories are diet or nutrition, exercise, sleep management, stress management, spirit, and patterns of behavior. So let's just briefly look at them. And after I speak about each of them, I'll try and show you how they actually tie into each other. Now, as a medical guide, this is a very exciting area because I can use creativity and work towards helping people make their decisions through an integrative approach about all of these things, because everybody is unique in terms of their sociology, medical history, and psychology. We know that. So, in the first area, we look at diet and nutrition. We're in trouble here. the food that we're starting to eat is getting worse and worse because it's being produced with antibiotics, steroids, viral cocktails, and additives, fillers, all sorts of things that we're now putting into our bodies. In fact, obesity is an epidemic in our country. I need to correct that. It's a pandemic. Obesity is now a problem all over the entire world. For the first time, there's more people that are obese than are starving and hungry. And this is partly because of the foods we eat. Now, getting back to the legislative and government part, the Food and Drug Administration is very important, and they need to be an important part of the process, but I believe they need to move to a higher order of consciousness, because for me right now, the FDA stands for Future Diabetics Association. Okay? So, in terms of, thank you. In terms of diet, we can look at areas of calories and micronutrients, macronutrients, antioxidants, etc. And this is very important. But what we're finding out is that even by changing your diet simply, you can improve your health and you can prevent, cure, or help certain diseases, many different types of diseases now. We're going to get into this a little bit more as we go on. I'm going to keep coming back to a number of things. So in terms of that, I would just like to say it's very important. Hippocrates said, let food be your medicine and medicine be your food, and I don't think there's anything more that needs to be said about that part. We just need to eat more wisely. The next area is exercise. Now this area is also very interesting because we all seem to know that we need to exercise, but the questions are how much, how fast, how long, what duration, and what mode. Do we do low impact, high impact, weightlifting, resistance, many other types of things. We need to do variations on all of this because, again, it's now been proven that just by taking an activity and doing a periodic but regular activity, it has the opportunity to help you improve your health and possibly prevent premature death and make your quality of life a little better. As a medical guide, this is very interesting because I get to help people make certain decisions. There are many people that have played a sport all their life and love that sport. Let's take tennis, for example. But they've got bad knees, they've got bad elbows, they're hurting all the time, but they love the tennis. It might be time to find either a new way of playing tennis, maybe not so competitively, but maybe change to something else. And this brings up the concept of looking at different types of exercises that we do. You should have multiple types of exercises. You shouldn't just be a person that goes to the gym. You should have something so when it's a rainy day, you can go into the gym or do something at home, but you should also have some outside exercises that you do, things that you can do that work different parts of the body and bring upon a much more interesting lifestyle, something that improves your soul. And more people are starting to look at things like Tai Chi and yoga and martial arts, various other forms like that. So I'll move to the next one, which is stress. Now, stress is all about hormones and neurotransmitters. That's basically what it's about. If you have a situation where you're in fear or anger or frustration or you're running from a saber-toothed tiger, the same thing happens. The body sends a message to the adrenal glands, and the adrenal glands become very Buddhist. They have no attachment to adrenaline. If you call for it, they let it go. And it squirts into your system. And things happen. And 3 new studies have come out, one from Harvard, one from Yale, and one out of Israel that have all proven now that anger can directly cause heart attacks. Now this happens more in middle-aged men, but because of the equality that's coming into our planet now, and I expect at some point it will be universal that everyone will be susceptible to this. And the way you can remember this process is just think about the 3 P's. The first P is pulse. What happens when adrenaline gets into your blood system? What happens to your pulse? Goes up. Number 2, pressure. What happens to your blood pressure when adrenaline goes into your system? Goes up. And the third P, and this is a great one because this is such a magnificent part of the body. The original plan for stress reaction or fight or flight was while you were running away from the saber-toothed tiger or while you were involved in a war against the Trojans or the Greeks, if you got cut and your adrenaline was working correctly, it produced a certain type of blood product that would help you. Does anybody know the name of the product? Platelets. So that's the third P. So when you get stressed out because you're angry over something or frustrated, you get elevated pulse, elevated pressure, and platelets running through your body which cause clots. Now somebody that already has a history of heart attacks, somebody has clogged arteries, this is just a contract for danger. Intermittent explosive disorder. This is an example of this would be road rage. More and more people are developing this, and the consequences of this are costly to our system in personal injury and property. So the cost of this is very expensive, and the simple ways of meditation, stress reduction, breathing techniques can help many people with this. The next is sleep. We are also in an epidemic in this country with the problem of sleep. There are at least 80 different sleeping disorders that are known today. We're actually a sleep-sick society. It's estimated that over 20 million people in this country have either an undiagnosed or an untreated sleeping disorder. So any of you that feels sleepy during the day, that feels like you would like to take a nap, and that actually could take a nap, may have the beginnings of a sleep disorder. Now we're fortunate in this community, we have a sleep clinic where they can help make these diagnoses, and in fact I believe tomorrow here at Cottage Hospital, the director of the clinic is going to be speaking on sleep disorders. We, as a society, obsess over our cholesterol numbers. We look at everyone knows our LDLs and our HDLs and our triglycerides and ratios and everything else, and we look for chemical markers to keep our health well. But we completely ignore this very important thing, sleep. We don't want our surgeons, our air traffic controllers, our children's bus drivers all having sleep disorders where they're real sleepy during the day. And in fact, there are studies that show that 1 out of every 4 drivers falls asleep at the wheel. So that means if you're on the freeway, in a 4-lane freeway, and you're awake, be aware. Be very aware. Because one of the other 3 people may be falling asleep. And at 65 miles an hour, an angle of maybe 3 degrees of a steering wheel will upset a lot of people. So I'm going to take one moment for a commercial. I did produce a CD called Sleep Suite to help people sleep. I will be selling that at the end of this talk. The price is $75 a CD. But if at the end there are rousing cheers, standing ovations, and calls for encores, I will bring it down to $10 a person. So, okay, 45. It's only, we're working. Plenty of time. Spirit. Spirit is something that is very personal. It's about grounding, centering, and having some connection and communication with the universe, the divine. Each of us looks for that in our own way, and I won't spend much more time on that, but you should. Patterns of behavior. Patterns of behavior start intrauterine. The body and the brain believe in patterns because the brain does really a good job in taking care of people, and it doesn't like us to mess things up. So it takes over the vital functions. The patterns start, they're breathing patterns that are in the brain. There are waking and sleep patterns in the brain, temperature control, acidity of the body, growth patterns begin in the brain, and many more. You know, pulse, blood pressure, all of these things start developing and continue throughout life. As we grow, as we become human and start interacting with other people, we start developing patterns of behavior. And these patterns of behavior are based on some truths and also on false myths. And we continue our life using these patterns of behavior. If you think about the things that you do, you probably put the toothpaste on the same way all the time, brush your teeth in the same order, shower the same way, do your cooking and preparation of foods the same way, put your clothes on the same way, get into your car the same way, all patterns of behavior. Because it makes it easier so we don't have to think about things. But sometimes patterns are not good. So it's very important to be aware of patterns of behavior and to recognize the good ones and keep them, but also to recognize the ones that are not good. I think it was Confucius that said, it's not a bad idea to get rid of bad faults. Okay, so in that same respect, he didn't say it quite that way. He also said it in Chinese. So, but it's important to recognize patterns of behavior and deal with them. Now, how do all of these, I said I would talk about all of them and try and combine them. So if you think about it, if you don't get enough sleep one night, you wake up in a bad mood and you're stressed out, so you're too tired to exercise, so you don't get enough exercise and digest your food well. So at some point you eat poorly that day, and if you eat the wrong foods, and if you eat at the wrong time of the day, you may not get to sleep well that night, and so it goes. It keeps going on and on. And in the whole process, it becomes, do we acknowledge all of these things and do we work on them to bring them all together for balance? If you eat well and don't sleep well, you're not balanced. If you sleep well, exercise well, are really spiritual, and your only diet consists of Coke and Snickers bars, you're probably not going to do well. You may have a little more fun at times, but that's the way it is. Now, other people in this order are starting, as I said, to become more creative and to go, for example, when you injure yourself, you might go, or you pull your back out, instead of going to the orthopedic surgeon, you might go to your chiropractor, or you might go to your massage therapist, or you might go to an acupuncturist. People are still in the process of, when I get hurt, I do something. So it's important to then move to the final stage. And as a medical guide, I believe that preventive medicine stage is a great stage for us to be, but I think we need to move to the next order. This is the order of consciousness of health. Now, we're still doing the same things, but we have a change in attitude. So we're no longer, we have all of our balanced programs that we're doing, but we're no longer doing it to prevent something. We're doing it so that it becomes our consciousness and it becomes our lifestyle. And that's the reason that we do this. Now, this order, I'm going to start to get into a little bit of the esoteric. And in fact, some of the topics I'm going to be discussing are ineffable. There are no words that can really describe some of the things that happen. So I've decided for the next 3 or 4 minutes I'm going to have you close your eyes. I'm going to close my eyes, and I'm just going to transmit to you without actually... Okay, you didn't buy it, did you? I wasn't going to be able to buy it either. That was a possibility. I had a shot at it for a moment. It could have worked. Okay. So, what I would like, though, for a while now is, and this is even very hard for me, but I would like everybody to think back when you were a child and maybe you read about Greek mythology. Did everyone remember the beautiful winged horse Pegasus? Well, when I read about Pegasus, there was no question in my mind that Pegasus could fly. In fact, this is my second dream. I used to dream that I would fly around the heavens all the time on Pegasus. And it was beautiful for me. So that's what I would like everybody to do for a little while now. I would like you to remove the analytical part and just allow for the next part of this program to bring things in. And as you're driving home today, you can then start analyzing and think about things from a different point of view. But I would just like you to be open to the process for right now. So let's move into the realm of energy. Energy is all around us. Does energy affect us? Can we work with energy? What is it about energy? Well, let's start with light. We all agree that light is a form of energy. Does light affect us in any way? Well, ask the people that live in parts of the world where they only get 6 months of light and they get 6 months of darkness. There have been many studies about mood disorders with people that don't get enough light. And how good does it feel if you've been working in an office all day long and you just get out for a few minutes into the light and just feel the light? It makes you feel good. Does light affect cells? Does it actually have an effect on cells? Well, we know that you can get a sunburn, so it clearly affects us that way. But also, light can affect cells in the sense that it allows us to absorb and create vitamin D, which helps to absorb calcium, which is important for many of the functions and systems and physiologies that go on in our body. Does light have any other effects? Yes, a very important effect. Light actually goes through our eyes and can get into our pineal gland, which is in the brain, and this allows for the either release or inhibition of a special hormone, melatonin, which determines whether we're tired or we're awake. So light energy actually affects cells in our brain and creates things for us. And how many people in here, you don't have to raise your hands, I'll just know, but think it so that I will know. And don't fake me out with a fake thought, because then my statistics will go bad. How many here have used candlelight and mood music to develop a romantic interlude at some point in their lives? Of course, we know that light works, and it does many things. It affects us. Let's look at another energy, sound. Does sound affect us anyway? Yes, it does. We already talked about the fact that certain types of music can make us relaxed. If you heard, if you're on the street and a car comes up very loud with music that you don't appreciate, it kind of irritates you a little. You might start getting toward that intermittent explosive disorder. But because you've been to this lecture, you'll get calm and you'll feel better and there'll be no problem. If you listen to the wrong music when you're eating, it may disturb your digestion. And if you listen to the wrong music at sleep, you can't sleep. So it can affect moods. Does it affect cells? Yes, it affects cells. If you're near a very loud noise, a bullet going off right near your ear, a rock concert, a plane, you can actually destroy cells. So energy not only can affect cells, it can destroy cells. So these are very powerful things. So now we start to look at the process of energy itself, and we look and move into some of the other types of healing systems. And these systems use energy. But before I go to that, I want to talk about the process of illusion. And you all saw that illusion there. There are many philosophies that say our mind and the ego and the senses have all created illusions for us. Everything we see now is an illusion. Everything about what we do is an illusion. And it's because of the senses, our egos, and our mind. So with that in mind, I've already showed you this slide once. Now, the slide is called My Wife and Mother-in-Law. And just out of curiosity, how many saw the wife and mother-in-law? You saw both? A few people saw both. How many saw just the wife? How many saw just the mother-in-law? Okay, I'm going to show you this again, and I'm going to tell you they're both there. So if you're capable of seeing them, there are two ladies in this. Your senses are working now. Now sometimes even after you see it, you switch back and you can't see it again. Now how many people can see the wife, the young lady? Okay. How many see the mother-in-law? Okay. So there are many people that are not seeing. How many cannot see both yet? Okay. And they're both up there. This is the illusion of what we're living with right now. We see things, and sometimes what we see we don't believe, and sometimes what we believe we don't see. So now I'm going to show it to you so that maybe you can see it better, or I'll let you keep trying to work with this and deal with your own illusions for a moment. This woman here with the face looking in this direction is the wife. Right? Everyone now see that? Is there anyone that does not see the wife? Okay, if you don't see the wife, it's a big picture, feather coming out of her hat, hair here, her eyelash is here, her nose is here, her chin is here, and she's looking in that direction. People see that now? Okay, let's look at the mother-in-law. Change your illusion, forget that woman, and imagine that this is the chin, here's the mouth, here's the nose, and this is the head. Can everyone see that now? Okay, see? Now this is the whole point here. We look at things every day, we see things every day, and we have beliefs about them. And it's possible that those beliefs dictate to our patterns of behavior, our decision making, and everything else, and we may be looking at illusions. Forget the big picture and look at the size of this here as the older woman with her nose is right here, and her mouth is here, and her chin is here, and her hair goes back. Does everyone see that now? Yes?
There's a third.
Oh my goodness. Okay, the title of my new lecture. Go ahead.
I didn't see the old lady that way. I saw her on the side this way. You could see eyes and a nose and a mouth, and it's kind of amorphous. It's not really distinct, but I saw that other than the older lady.
Isn't that a metaphor for all of what we're talking about now? It's amorphous and not really distinct. So this sets me up for the concept of where we're going now and what our beliefs are and what we've been told to believe. They may be illusions, and the things that we're not believing may be the reality. So as we move into the fields of energy and the different types of modalities of healing, we look at things like traditional Asian medicine, or TAM. The acupuncturists and the people that practice this use an energy that they believe called qi. And this qi flows around the body in various meridians and channels, and there's all sorts of science about it, and philosophy about it, and laws about it, and they use their excellent knowledge to find acupuncture points along these meridians to help move this qi to make people either unblock something or improve something and improve a healthy flow. When the chi is flowing correctly, the person is in balance. And this is part of their process. Interestingly, the Mayan culture had almost an exact same system with their meridians and points, but they looked at the energy as a wind. They called it a wind. Now, there may be interpretations and things like that, but I don't know. They just called it a wind. So if we look then in Ayurvedic medicine, which is out of the Hindus in India, they have a different energy system that they call prana, and it has to do with the breath, and this has to do with what we call chakras. I will speak about chakras later, but I just wanted you to see this slide because I thought it was fun to look at for a few minutes. But chakras are supposed to be energy vortices or vortexes, I think it's vortices, in certain areas of the body that each represent something else. And the Ayurvedic people use this to heal and change their energies to make people healthier. If you have trouble believing in these things and you think these are illusions, I would say a few things. First, number one, the people that are practicing these, like the traditional Asian medicine people and the Ayurvedic practitioners, they're very clear on it. So if you go to them, you don't have to worry. They can work with the chakras and they can do other things. And they can work with your meridians, etc. The second thing is that some of the other philosophies talk about other subtle bodies rather than just chakras and meridians. They talk about astral bodies. They talk about auras around us. They talk about emotional bodies, mental bodies, bodies of the higher self, the supreme self. And many people work with these energetic bodies. For me, I don't see them yet. I accept them because of the wife and mother-in-law, and it's just that I don't see them yet. But what I do is I take these subtle bodies and bring them into the concept of it's just the smaller parts of each cell. So the subtle bodies for me might be in the nucleus where the DNA is, or the subtle body might be in the mitochondria of the cell where the energy is and the ATP is produced. So, and when we look at this, we can understand that there might be systems that work to promote healing. If we go back to energy again and look at all of these things, we can combine things and say obesity, for example, is a form of energy imbalance. It's a form of how many calories in versus how many calories out. Calories are translated into ATP, that's energy. Another form is that we expend, as a human, every day about 75% of our energy is based on our resting metabolic rate, which is in turn based partially on our exercise and how much energy we put out. When we sleep, we're trying to restore energy. So many of the things that we talked about before, exercise, diet, sleep, stress, all of these things really have an energy component to them. They really have an energy component to them. So I would say that we need to start looking at the process and thinking and believing that there might be ways of looking at energies in a different way. So I want to move now for a few moments, and now that I've talked about 3 of my orders of medicine, and we'll go back to it, or health, I want to pick a system in our body and go through it again through the 3 orders of medicine. So I went to the drugstore and I went to grocery stores and I looked to see over-the-counter drugs, which one has the most to cover that system. And who can guess which system it is in the body? Louder? Gastric, did somebody say? Gastrointestinal system is exactly the one. Has everything. It has something for bad breath, for belching, for spasm, for hernias, for ulcers, for constipation, diarrhea, hemorrhoids, flatus, everything you can imagine. And so many choices. As a medical guide, I'm not sure where I want to go with this. But the intestinal tract is one of the most hostile territories on the planet, and it's living inside of us. Think about it. In order to get into the intestinal tract, you have to go through a set of teeth that are capable of piercing and ripping and shredding flesh. Okay? You have a mouth that secretes solutions that can start breaking down food. You have bacteria in the mouth that among the vertebrates we rate as in the top 4 of having the most infectious bites on the planet. I'm sure you're curious, so I'll just tell you. The alligator, the leopard, and the camel are the 3 others. So we're in good company there. We have a muscular organ that has 3 layers of muscles that's forcing things down into it. We have a stomach that has it has hydrochloric acid in it with a pH that's so low that if you wouldn't put it on your skin. We have things that are secreted from our gallbladder and our pancreas that have been given the name bile. The territory itself is filled with villi and hills and valleys and crags and everything else that just go on and on. It's a dangerous territory. There's feces, there's toxic gases in there. In fact, 2 of my favorite toxic gases are produced when the body starts to die and decay. And I love the names of these 2. One of them is putrescine. The second one is cadaverine. Now, I will say that within this whole process there are a number of good things, and I'll pay homage to my pathology professor, my anatomy professor in medical school, who one day took us in our class and he had us all stand up and he made us all say, "All hail the anal sphincter." Now this is a truly Buddhist organ. And the reason for that is without using any of its senses, it has no sight, no sound, nothing else, and yet it's able to distinguish between gas, liquids, and solids, and allows them to go through. Thank you. The intestinal tract also is the place where we assimilate and biochemically degrade our food that allows us to get to a place where we can use it for proteins, carbohydrates, and fats, and for energy. So it's a big plant, a biochemical plant. It also houses about 70 to 75% of the immune system in our body, where the immunoglobulins are produced and stay. And it also is one of our major host defenses. For all the foods that we eat now, it protects us from things that might be in there and kills them. So what's happening now is when we say the concept, "you are what you eat," that's only partially true. The second part of this is you are what you absorb. And because of the foods that we're putting in that are filled with all of these additives and unhealthy things, we're essentially putting sludge into our intestinal tract. And because of this, we're blocking the areas and we're destroying the microorganisms that break down things to allow for absorption. So when you're sitting at the Natural Cafe and eating all of your good stuff and popping your bag full of antioxidants and vitamins and minerals and feeling really good about your healthy self, it's very possible that if there's sludge in there, all the stuff that you think you're eating is not getting absorbed, and it's not going to give you the effect that it really needs. So I would like to speak more about root cause analysis. In medicine and in other industries where health and lives are at stake, such as the airline industry, we do something called root cause analysis if something really bad goes wrong. So when doctors see a patient and someone has a headache or someone has stomach pain, they go through diagnostic procedures and everything else and come up with a diagnosis. And for a headache, someone may be diagnosed with vasospasm or spasm of the artery, and they will treat that. For the stomach ulcer, they may be due to acidity, or it may be due to an overgrowth of a certain type of bacteria, and they'll treat that. And for me, I'm pretty happy with that if it actually treats it. And what I mean by that is it cures it and it never goes away, because we do have medicines for that. And if we don't have medicines, in Western medicine we have very sharp-edged instruments that will remove things. So between those types of things, these are the ways that we take care of things. If things get better, then I'm fine with that. But if they return on the medications, then I have to go to more of a root cause analysis and say maybe something else is causing this and we need to go deeper. So I'm going to take an example right now of a young girl, an 8-year-old girl, who loses her father very suddenly in a car accident. And she does a certain amount of grieving. She's very confused, doesn't understand the whole process, goes through certain things. A few weeks, a few months later, she starts developing strange symptoms and some abdominal pains. Mother gives her the remedies and it gets a little better, comes back again. She finally goes to the doctor. Depending on your HMO plan or whatever, you're either going to get diagnostic workup or the doctor in their brilliance are going to be able to figure out what you've got and they're going to give you medications for it. And they may work for a while, but then the pain may start cycling again. And this time they run and they do tests. And the tests don't show anything, so they give more medications and they're starting to think, well, maybe a little psychiatric or clinical help in that direction will work. Do more things, some improvements, cycles, better, worse, better, worse. After about 10 or 12 years, it gets so bad she's in the hospital. They do more diagnostics, and they finally recognize that they've got a title for her, they've got her labeled. She has ulcerative colitis. Okay? And that's not the end. That's pretty much the beginning, because then you start on steroid enemas, you start on pain medications, which you get addicted to, and you have to go to stronger ones. You have cycles of healing and worse, and then you have psychological issues, because if you have episodes of diarrhea, you don't want to go out with friends because you just can't be sociable, so you end up having multiple surgeries, you have a colostomy, many things go on. Now, those are in the first and second order of medicine. I want to move a little bit to the third order, and I want to give gratitude to my colleagues at the Santa Barbara College of Oriental Medicine here in town who have given me great insights. Let's move into a different way of thinking for a second. Many of the meridians that we talked about before and the organs of our body have different meaning for us. We have a meridian called the large intestine meridian. And the large intestine is a hollow organ, and it's connected also in the energetics with a solid organ called the lung. Now, the large intestine has to do, as we all know, with evacuation, right? But if you metaphorically translate evacuation into letting go, you might start seeing about issues that you might look at things differently. And then if you connect to the lung, which is an organ that has to do with grief energetically, and you connect the two and you say, is it possible that this ulcerative colitis started out because the girl had a problem letting go and grieving? It may be a leap for certain people, it may not be. For me, it seems to be becoming more and more evident that's possible. Which means that if this person, this girl, and for the future, many other people, have the opportunity to, when they get into the healthcare galaxy, have the ability to see things from a number of points of view, who knows the possibilities of what might have happened with this girl and many other people. We also think about, we've all heard this story about the couple that have tried to get pregnant. And they've tried every means possible. They've gone to doctors, they've gotten all the tests, they've gotten all the checks, they've done the in vitro fertilization. All of these things have happened, and they're not getting pregnant. So what do they decide to do? They really want a child very badly. They go to another country and they adopt a beautiful child. Well, everyone knows the story of what I'm going to say next. What happens a year later? They get pregnant. Now, did this child from another country have the ability to repair an anatomical defect in the fallopian tube for the mother? Or did this child have the ability to improve the viability of the sperm in the father? Maybe. But maybe there was an energetic block somewhere, or a neuro-emotional, psychiatric issue that had to be dealt with. And if this couple and many other people deal with these and have the opportunity to look at things from various points of view, to be treated empirically by energy healers in different ways, it's possible that many of the problems that we have nowadays will be eliminated. Maybe new problems will occur, but for the most part, I believe that our process is about an integrative approach to this whole thing. And in this concept, it's about going from awareness to consciousness. What do I mean by that? Awareness is, I know that refined sugar is bad for me, but I really love it, so I'm going to keep eating it. Consciousness is, I know there are better things to eat, and I'm going to eat those. Now, there's probably a variation on consciousness that says, I know the refined sugar is bad, so I'll eat a little less because I still enjoy it. But if you enjoy it, that's about higher consciousness also. So, in moving toward higher consciousness and using the chakras again, maybe in a process of daily meditation or daily work, we can use the chakras for something different. Even if we don't believe that there's a vortex of energy inside of us that is doing something, maybe we can use them as metaphors for our daily questioning and affirmations about ourselves to bring ourselves from the level of awareness to higher consciousness. So even though there are about 252 chakras that different people speak about, there are usually the 7 basic chakras that people mention. And I'll start with the lowest chakra, which is the base or the root chakra. Now with this, you don't have to imagine that there's energy. If you do feel it and you can move with it, that's fine. But if you don't, you can talk about what it represents. You can say to yourself, this is about basic survival, basic needs. And just deal with that. Question yourself. Do I protect myself? Do I satisfy my basic needs and basic survival? And affirm it to yourself. Yes, I do these kind of things. Then you can move up to the next chakra, which is the sacral chakra. And this has to do with sexuality. It has to do with emotions. And emotions are the neurohumoral response, not the cognitive response of feelings. Do I acknowledge my emotions? Do I work with my emotions? Do I accept them? It also has to do with creativity, and you can affirm and recognize that process inside of you. The solar plexus is partly about power, and it's about self, and it's also about assimilation and digestion, because this is where we digest our food, which, as we've already said, gives us energy. So this is about getting energy. It's about saying to yourself, I stand up for what I believe, and if there's a person around me that has something that I believe but the whole group doesn't, do I stand up for that with them? So working on that one. Now the heart chakra. This is not the area of the four chambers of atria and ventricles. The heart is such an important chakra. Just think of it in your chest for a moment. And this is about love, it's about devotion, it's about relationships, it's about compassion and healing. So I want to take just a moment to spend time on the heart chakra, and I would like everyone to sit up for just a moment, sit in your chair, kind of ground your feet, and just close your eyes. And I want you to think in the center of your chest, and I want you to imagine your heart chakra, and just for a few moments, just breathe and start to see if you feel and hear an energy that's going in the center of your chest, and bring out the love and the devotion, compassion, healing. Gracefully open your eyes and let's move up to the throat chakra, which is about speech, truth, self-expression, self-growth. Acknowledge, do I speak the truth? Do I gossip? Do I spread rumors? Do I listen carefully? Do I communicate well with people? The third eye, or the first eye, this is about intuition. Do I respect my own intuition? And it's interesting that sometimes in connecting different things like meridians, what do we always say? Go with your gut. So the third eye and the gut, they must have a connection somewhere. And isn't it very interesting also that the pineal gland is in the exact same place where the chakra for the first eye is? And they both have to do with light. One is enlightenment, one has to do with waking and sleeping. The crown chakra has to do with accepting knowledge and grace and divinity and pursuit of understanding. So with all of these, I just want to say a few more things and I'll close it. I believe we're born with a gift. We have a mission and a responsibility. The gift is our brain. It's a fantastic organ. It's supplied by other systems for nutrition and transportation, and it has the mind in it. We have a mission, which is to go within inside of ourselves and find our destiny and accomplish our destiny. And we have the responsibility of going to higher consciousness so that we can develop a healthy style to balance ourselves so that we can help our brain and our body to be healthy and maintain ourselves for our mission. I want to say that this talk today was about health consciousness, but in reality it was truly about just higher consciousness. So it's the idea of taking ourselves as a species from moving from human doings, which is what most of us are, to become human beings, where we're actually being. And I chose the path of healthcare because it's the path that I love, it's the path that I know the best, and also I believe that it's the most important. So I'll just leave you maybe with one thought. Thank you for your time and consideration. If anybody has any questions, I'll be happy to answer them, or I will be, I have some cards there and some flyers, and if anybody is interested in a CD, that did bring it kind of down to $10. Maybe 12. So if anybody has any questions, I can answer them, or I can meet you up on the stage and we can talk afterwards. Yes?
Well, I think it's very unique that as to higher consciousness or whatever you'd like to call it. Can you talk to us briefly about your process in doing that?
Well, I've always had the interest in other philosophies and other religions and ways that other people looked at things, be it art, music, and everything else. And I saw that even though they were completely different, in art, for example, if you look at Western art, in doing perspective, everything is big at the beginning of the art, and as you move backwards, it gets smaller. And that gives you a sense of perspective that makes you see things going off into the distance. In Chinese art, they're completely the opposite. Everything up front is small, and everything in the back gets bigger, and that's part of because they review and view nature as more important than humans. But when you look at the art, it still looks the same. You can still tell perspective. So I always felt that there was importance in it. As part of my healing processes, I've gone through a number of illnesses and injuries myself, and it was clear to me that Western medicine was able to do great things for me up to a point, but I needed other areas. And then I took it to the point of, okay, now it's not about illness and injury anymore, now it's about prevention, and then I went to the next step. It's not just about prevention, it's about consciousness so that everything takes care of itself. I'm still going to get ill or injured, but when I approach it, it'll be different. I don't know if that answered your question. Okay, yes?
Can you talk about being a medical guide?
Yes.
Are you saying helping people find health through all of these different aspects and integrating them for that person?
Exactly. When somebody comes to me, I help them make the decisions that they probably already have some idea in their mind already, and I help them to make decisions, but we look at a completely holistic, integrative approach and give ideas. We can go in this direction or that direction. And as a guide, I don't have an ego to determine and say, no, you've got to go to this surgeon. If you say to me, surgery isn't what I want to do, I can step back and say, good, these are some of the other alternatives, and then we can consider surgery again, because it might be a better time when you feel a little differently about it. So it's basically helping people to make medical decisions through an integrative approach using all of the healing systems that work on the planet today. And within that process, sometimes it gets to a person where it's not just about the illness itself, but it also has to do with lifestyle, and then we start looking at balancing programs. Like, why are you having, okay, we're going to take care of your ulcerative colitis, but why do you have it? Is it because of your diet? Is it because of your sleep? Is it because of spirit? So then we might look at all of those things. So that's the process as a medical guide that I would take people through. Good question, thank you. Good question. Question from South Park. Okay, thank you very much.